So you have a medium type of pain with some arm symptoms. The good news is things are not out of control for you. And what's nice is you have the time to set up a program for how you're going to treat yourself. So for me, if I were you, what I would do is I'd make an appointment with a spine surgeon to see, first of all, what's sort of my worst case scenario. I would start there and I would almost work backwards. So I'd want to know from that person, if nothing else helps me, what am I in for? And just put a flag in the ground as knowing that's my goal and I'm going to try to avoid that. But I would talk to the surgeon to make sure you don't have a large herniated disc, to make sure that you are examined, to make sure you don't have significant weakness. So you sort of want to answer the worst case scenario first and then work backwards. And then once you've done that, you can do, what I would do is probably start with either physical therapy or a chiropractor and see which one helps me. You could start maybe 1 week of each, see which one I liked, and then I would continue with that. I would also do acupuncture, because why not? You know, that'll help some of the pain. And I would also try traction. I love home cervical traction. I'd buy a unit on the internet and I would do that. I'd also be trying some medications, but I really wouldn't be so crazy with the meds. I don't like medications myself. I'm very concerned with side effects, so if I could avoid medications, I would. I would use the medications more to help me sleep at night. So I would take a pain pill, like a narcotic at night, to help me sleep. If I sleep really well, I know I'm going to function better in the daytime. And maybe in the day, I would maybe take an anti-inflammatory like a naproxen or Advil or Aleve. And then I would follow that along. You can try other things such as biofeedback or other types of therapies, but I really think to start off with the ones I've mentioned is what I would do personally. And I do think there's a good chance that you'll get better on your own. But if it's going on for, again, more than 8 to 12 weeks, I would head back to the surgeon. I would start learning about what it takes to fix it, because this will drive you nuts long term, and it's easily fixed, and it may be something that is going to happen as far as having the procedure. So I'd learn about what my options are. I'd visit the patient stories section of the website, talk to people who've had it done, and take it from there. So good luck, and I hope you do get better.